Before I first, I would like say huge express thanks our Ibrahim Jafarov. Thank you other teachers and students. Today, before I first, I would like add some information about me. I'm lecturer Nabi Vanigar from Department Therapy, Gynecology and Surgery. My subject veterinary surgery. And before I first, I would like to say about information about head operation. It's difficult operations, yes, but very interesting topic today. This is special part of surgery, head operations. Before this head operations, we talked about only sutures. We talked about general anesthesia. We talk about what is surgery and how we should wash our hands before operations, sterilization methods, mechanical methods, and others information. But today we will talk about head operations. Head operations, before I would like some information about anatomical structure of head. This is, we can see arousal of cutaneous innervations. Cutaneous innervations in this, this is fascial part of which the entire scalp, a cattle, divided some branches of nerves and arteries, which we should know. And here we can see this trigeminal nerve, has a trigeminal nerve, which divided some branches. The first, this is maxillary, mandibulary, and this maxillary and mandibular nerves divided other different nerves, which now we will talk about this. Trigeminus, which is further divided, this is the orbital nerves, which should called ophthalmicus. Ophthalmicus, and this is in horses and cattle divided the same, but through the round eye opening in cattle has branches. We can see here this ophthalmicus divided zygomaticus, the lacrimal nerve, and this is infraorbital nerve and frontal nerve. Frontal nerve, after that nasal nerve. Nasal nerve divided ethmoid and subloc nerve. After that, I would like to say some information about maxillary nerve and mandibular nerve, which were important during operations, during anesthesia, which we want to operate it head, on the area on the head. The maxillary nerve divided into the zygomaticus, infraorbital, and wedge palatine. But mandibular divided buccal, this is chewing muscles, this is deep muscles, superficial, lingual, pterygo, and anterior alveolar mandibular nerves, which divided this maxillary nerve, alveolar mandibular nerves. We should know about the structure in anatomy, mandibular and maxillary nerves, nervus ophthalmicus, nervus trigeminus, which important during operated in the head operation. And here we can see head structure. This is cattle, division of the head of cattle into regions, and I will show now some places. It's not a lot of information here because we have enough time. The first, I would like to say the back of the nose. Here we can see this nostrils, lower lip, upper lip, lower lip, and this the certain eye sockets here we can see, and this is chewing muscles which located here. Horns we can see here, and auricles, head. This is jugular groove and atlantis, and some places which now and this is important places, the edge of the lower jaw, which located 14 and 15, which this is temporal, located here. And eye, which located here, upper low, upper eyelid. And we know this structure, we operated during head operation. We should know about the structure auricule, which located here, horns, lower lip, upper lip, you can see here upper lip, lower lip, and nostrils, nasal, here nasal septic, and this is maxillary nerve, which located here, and mandibular nerve, which located here, and has some branches. And this is structure of head of cattle, but some structure the same of the horse, same, but some different places which we should know. Division of the horse's head into areas. Here we can see back of the nose. This is back of the horse, which had in the cattle, and this is chewing muscle, and this is jugular groove, atlant, and lower lip, upper lip, nostrils, and buccal nerves, maxillary nerves, mandibular nerves. Mandibular nerves located here, maxillary nerves located here, the 4 maxillaries area. And here we can see the 5, this is dental area, the 6 mandibular area, and which important, this is 15, supraorbital. We should know this information because during anesthesia, we should know some places, because some places innervated, located maxillary nerves, mandibular nerves, because when we want to operate it, this some places of, for example, the horns, operation in the horns, operation in the eyelid, we should know where located these nerves, maxillary nerves, mandibular nerves, and nerves ophthalmicus, infraorbital nerve, and so on. And here points, some points, nerve blockade. Which points of nerve blockade of the horse head. Has here some places. This is, for example, interval between A, B, this is front line, which located A and B. This interval we should call front line. CD, orbital line, CD, which located here, interval, CD. And I and E, line from the end on the facial crest, which located interval between A and E, here, injected points of nerve blockade, and about some information about nerve. The first, which located maxillary nerve, here. The second, this is infraorbital nerve, and the third, front line nerve, and 4, this is sublock nerve. This innervation in horses we should know because has some places here, which interval located A, E, this is infraorbital, this is sublock nerve, this is frontal nerve. We should know because this is maxillary, mandibular, infraorbital, sublock nerves located in the anatomical structure between, this is interval between, and we should know about this. This is points of nerve blockade of the horse head. But the same, this information the same in the cattle. And beginning with, for example, the first operations in the nasal area. Nasal area, we should, in anesthesia, we should apply the anesthesia. And the first, this is operation, has indications, has a first, we should talk about indications. After that, fixed and pain relief. After that, operation technique. This is infraorbital nerve block, about indications. Operations may be in the region of nasal septum, in the nasal, maxillary sinus. When we operated, for example, teeth, which located second malar in the maxillary side, maxillary nerves, and up to the second malar. Technique of pain relief in cattle. This information cattle, which the same in horses, Novocaine blockade, And maybe doses may be different because doses of anesthesia depends of age and weight different animals. But the same structure, which located nerves, where located and where we should apply it, suture, where we should put anesthesia, injected anesthesia, the same. And an external orbital drawn from the outer orbital edge, which perpendicular to the teeth of the second malar, maxillary nerves. This is when we want, we can palpable very easily, has a throat anterior edge, throat between the anterior edge, and these places intersection these two lines, we should inject the 10 ml 3% novocaine solution. And after that, we now these indications the same of horse. Horse 15 ml 3% novocaine solution we should inject it, but the same place. Anatomical structure may be same. Maxillary nerve block and anesthesia technique. Maxillary nerve, this is a very important blockade nerve during head operation. Maxillary nerve, here we can see which give good effective with maxillary nerve when we blockade during operations, because these operations occurs, anesthesia occurs after 7:30 minutes and last 1.5 or 1 hours. Has a two intersection two lines, which this maybe here we can see. We should know, for example, this is, for example, auricle of this head of. This is, for example, this is head, for example, this is auricle, and maxillary nerves, which located in the teeth two malars. This is nostrils, eye. And for example, here we can see this interval which located between two intersection two lines, which located the middle of this interval, middle point located nerves which we should inject it. Injected 5 ml 3% novocaine solution. Has some places in the head operations when I should show interval in intersectional points, intersectional sides, when I should show you. And here we can see, and I say 5 ml in horses, but in cattle injected 20 ml 2 or 3% novocaine solution. And here has one very important moment. After this procedure, after injected, we should remove this needle very quickly, and anesthesia may be occurs, and I say 7:30 minutes after this procedure, and 25 and 50 minutes may be last. Sometimes we want, for example, checked this sensitivity of these animals. After that, after 10 or 15 minutes, we can see sensitivity is lost of these animals after anesthesia. Inserting is nose ring. I think inserting is nose ring, we should this procedure in the farm, and for example, this owner of animals in the farm use inserting ring. Why we should use inserting ring? Indications. The ring is inserted to the nasolabial, internasolabial during anesthesia. And we use septum of the 1 year, this is breathing bulbs, and we use prevent the violent disposition. And fixation and pain relief. How we should use this anesthesia and which anesthesia we should use. The pool is placed on a stand and the head firmly fixed in the machine, and we should keep head very firmly, and we use antipsychotic drug. This is maybe antipsychotic drug, maybe, for example, novocaine, maybe chloral hydrate. And we should use injected intramuscularly. Which tools we use during this? We can see the restricting ring which opened here. This is 2 places and closed. We can close this. And after that, before this, I would like to say which tools we use during this operation. Tools we can use restricting ring. We use special pliers, and restricting ring may be different. For example, the structure here we can see the circle shape. Maybe how we should fix it in the nasal septum, in balls, breathing balls. And here we can see inserting the nose ring. How we should? This is forceps, special forceps, restricting ring for breathing balls. For example, we can see how we should fix to the nasal labial during anesthesia. After anesthesia, for anesthesia we use 5 ml, 20 ml novocaine solution. This places which I said has some points near this nasolabial, and here we can see this restricting ring opens here and inserted in the nasolabial into the nasolabial septicum, and after that with this forceps we should close this restricting ring. Restricting ring used in the farm of breeding bulls. Maybe this operating may be do, for example, this owner of this animal, cattle, and this position we can see during operation here. With forceps, we should insert the restricting ring. And technique and operation, nasal septum and the tip of the nose treated 0.5% ammonia. We use ammonia because give good effective during anesthesia, and the place of insertion of the ring, this is posterior. We can see section of the membranous part of the nasal septum. This is main important places. This is where we should insert it restricting ring. And plastic nasolabial mirror, rhinoplasty. What is this operation, rhinoplasty? We use in the bulls breeding, which has a 1 year old age. And indications. The operation is performed on breeding bulls in which part of the nasal septum and the nasolabial mirror, and inserted specific nasal ring. Fixation and pain relief. Here we can see this interesting moment, fixation and pain relief has a lytic mixture. What is lytic mixture? Lytic mixture content, this is solution, diphenhydramine, aminazine, and here we can see novocaine solution. But doses may be different. Novocaine solution we should inject it 30 ml and 2.5% aminazine we should inject it. This is 1% diphenhydramine 10 ml. All of these indications we should call lytic mixture, which the mixture this novocaine, dihydramine and aminazine. After that we can inject it. But this mixture we used only bull breeding, which weighed 1,000 kilograms. And the best effect is caused by the intramuscular injection after 4-5 minutes. And I think in calmed animals will be very useful, this anesthesia in calmed animals. And lasts 1.5 or 1 hours, this operation. Here we can see rhinoplasty. And technique operation, I would like to say about this, very interesting, and because lasts 15 minutes this operation, and here we can see fixation of with ropes restricting ring to the horns after operation. The first, here we can see operation technique. With tools we use scalpels, we use needle holders, we use threads, tampons, which we want for use for stop bleeding during operation. We use tampon and scalpel, sharp scalpel. With sharp scalpel, we cut calcified part of this nasal labial. After that, we disinfected 1:3000. This is 5% iodine solution. And after that, when we use scalpel, 1-2 seconds after, we should put looped shaped or knotted sutures. And immediately after this procedure, we shouldn't put a restricting ring because will be damaged. This is again damaged, this nasolabial place. We use, and I said, scalpel, needle holders, needles, threads, and tampons we use for stop bleeding. And the second here, this picture, we can see loop-shaped sutures during applied to the nasolabial mirror. We can see 3 or 4 sutures, but will be loop-shaped sutures because very good fixate the skin, nasolabial skin. And the third, I said, we can see this place of application of sutures, loop-shaped sutures, and after, when we want apply restricting ring, we should, after 2 weeks, we should put restricting ring and fixate horns to the horns with rope. And about operating technique for this, on the picture I said about this. For stop bleeding, we use tampon, and after operation, we washed special solution, 3% hydrogen solution. We use some different disinfection solution. And we put sutures with sutures cat code, which number? This reads cat code number 8, because give good effective. After operation, we can use this effect. For example, the ends of the threads tied 3 knots, 3 or 4 knots, because this is depends of damage of nasolabial mirror. We can put 3 or 4 knots. But this operation we performed 15 minutes. Elimination of blemish in sucking cows. What is this operation and what is this? Has an indication and fixation and pain relief operation technique. Indications we use in some dairy farms has a which cows, cattle has a defect, self-milk of mutual milk production, and loss of milk, problems with teeth on the udder, for example, loss of milks, violation of the sexual cycle, mastitis, which is these problems, diseases, indications we use elimination of blemish in sucking. And what is this? These indications, which I said, cause significant economic losses. And fixation and pain relief, we should failure fixed this animal in the machine. We fixed where the keep head of the machine, and we use antipsychotic drugs. We can use antipsychotic drugs. We can use tranquilizers for calms this animal. And which tools we use during elimination blemish of sucking cows? We use these tools depending the method of the performed palliative methods. We use restricting ring, which has 3 chain links. But maybe without these 3 chain links, maybe only restricting ring, but with a needle on the tip. We use this restricting ring. And operation technique, a ring with a blunt ends, which has a insert into the nostrils. After that, using we can use forceps, we can use needle holders, needles, and the edge of the ring brought together so that don't fall out of the nostrils. Restricting ring. I would like to say restricting ring, we want to apply it after 3 or 4 weeks if we want to do it, because after operation we should use this restricting ring to the nasal labials after operation will be damaged, this nasolabial, and I think it's not good effective if we after operation immediately want to insert to the restricting ring. Devices to prevent sucking cows from sucking milk. Here we can see, which I talk about this, we use restricting ring with 3 chain links. Here we can see, we use, which has a 3 restricting rings, which has 3 chain links. Here we can see restricting ring, how we should close in the internal, in the nasolabial mirror. And this is devices, this procedure, these tools, we use devices to prevent sucking cows from sucking milk. Here we can see this restricting ring, nylon, which material nylon, which opened here. When we opened these places, we can use during this procedure, we use during from sucking milk. This we use nylon restricting ring. Has a different color, has a different shape. I think in the present time very useful, this restricting rings. This is maybe color yellow, maybe red, maybe blue, and has a interval which has a 23 milli internal. This is long 55 millimeter and 5 millimeter when we close this interval between. And we use this in present time. It's not iron restricting ring because may be damage to the udder of this cattle. Here we can see how we should use restricting ring, which materials nylon. This is maybe different color, orange, maybe red, maybe blue. And instruction, how we should use this restricting ring to the cattle. Bring the weaning device, this is a special device which opened here and closed with these places. This is for calf's nose. When the calf is going to eat milk, the tip of the weaning device will hurt the cow because after 2 weeks and after 10 days, after 1 month, we can see result. And here we can see has this shape, which has on the tip needles, which damaged udder of cattle. Here we can see this is green color. And this picture very good show this effective when these animals want to suck some milks and this cattle don't give with because help this restricting ring, nylon restricting ring, which has some needles on the tip. Here we can see which we use in the farm livestock animal weaner, has a different shapes. Here we can see different shapes in different color, and but this is work, this restricting ring. It's not matter. This is nylon or iron. Has a needle, a lot of needles on the tip, around on the restricting ring. Weaner may be red plastic weaning tool, calf cattle we use for prevent sucking. This is iron restricting ring, which has a needle. But I think this restricting ring damaged a lot of because this is iron, and here we can see this is tools, iron, which material iron, and at the present time we use nylon restricting ring because give good effective after 10 days, after 2 weeks, then iron maybe 1 month because damaged udder of cattle and will be very difficult condition of cattle. About frontal nerve, when we use during operation, when we want to operate frontal place, different operations, maybe horse and cattle for heart surgery, and when we want to do operation on the upper lid, upper eyelid. Horse blockade technique and cattle blockade technique the same, but have maybe different doses where we injected, but anatomical structure the same. Horse blockade technique, palpatium above the orbit, the area of the zygomatic places, and we should inject it here 5 ml 3% solution of novocaine, and we should use one places here to anesthesia the upper eyelid with a needle. It is necessary penetrate into the supraorbital opening to the 2 or 3 centimeter dips. We should know about dips, these places where we injected 2 or 3 ml novocaine solution, but doses I think depend of age and weight of animals. After that, the frontal nerve blockade we use in the cattle. But in the cattle, anatomical structure may be the same, but when we needle inserted through the base of the upper lip, upper eyelid in the middle, and we should inject it one places. The injection dips maybe 2 or 3 centimeters, but it's not 5 ml. We should inject it 10 ml, 3% solution of novocaine. And this anesthesia occurs after 5 or 10 minutes and lasts 1.5 to 2 hours. And here has one moment about operation of horn surgery, with maybe 80% this horn surgery. This is maybe do this operated in the farm, in the clinic, in our country. And indications has two methods for use this operated for horns. First, prevent to development horns and removing the horns. Prevention of horn development based on the destruction of the epidermis and the base of the horn skin in area, and in calves we use 1-3 weeks. It's not very quickly, because we should wait 1-3 weeks old age this cattle, and after that we should use this operation. We use for removing the horns, and we can use this method preventing the development of the horns. And has two methods, and I said about Maxibastion technique. We can this is prevent the development horns with Maxibastion technique. How we should use this Maxibastion technique during this operation? And Maxibastion process, this is operation because maybe use cauters, some special cauters. We should wait after when we to destroy the horn tissues. When we want to destroy these horn tissues, we should put these cauters and should wait 5 or 3 seconds. And after that we can see light brown color of this area. And after that, if it has stopped bleeding occurs, we should stop bleeding with tamponade mechanical methods. And the restricting scalp will spontaneously disappear. This after 2 or 3 weeks, but it's not later, 2 or 3 weeks, because this is practice show this. And here we can see with pliers for slipping the rubber ring into the base of the horn with straps. We should rubber ring, because when we applied rubber ring to this cattle, and after some minutes, when we apply this rubber ring, some minutes we can see these places of light brown color. After that, removed horn. We should apply it, this is rubber tube with forceps surgical forceps. We need forceps here, tampons we need, and special forceps for applying this rubber tube on the base of the horn for removing this horn. Removal of horns and has two methods: removal of horns, bloodless method and bloodless method. Bloodless method we use, and I say it, with rubber tube. The ring should be made of vacuum rubber, outer, which is this rubber tube, which internal diameter 15-20 millimeter, and in the diameter in the outer, and internal inner diameter 9-10 millimeter. And about width, this is a width 5 millimeter in the internal of rubber tube. The ring, and I say it, is put on the base of the horn with special forceps, with special tongues, and if we cannot see special thorns, we can use special hook knob. And we can use ribbons. This is bloodless method when we use 1 or 3 weeks. This is cattle. But bloody way may be fixation and pain relief. Has the indications. Bloody way we use only adult cattle, because we use bloodless method in the 1-3 age old cattle, but bloody weight we use adult cattle. Most often the clinical indications you can see here, and fixation and pain relief. The operation performed a standing animal, which position in the machine. We should keep this head with horns, and where we can see this we use nasal forceps during this bloodless way, during operation, needle holders, needles, reeds, and special forceps for removing horn. And here we can see horn nerve blockade technique, nervus cornus, which located here. And needle injected, this is nervus cornus, horn nerve blockade. This anesthesia may be occurs during 1 or 3 minutes, but lasts this operation 1.5 or 1 hours. This anesthesia may be continuation. And when we injected with needle this anesthesia, Novocaine solution, which located nerve here, and after 10 or 15 minutes we can do our operated. This is remove horns. And horn nerve blockade technique, nervus hornus. And about this, we should keep in this is needle, dips of 1.5 centimeter in dips, and we should use on milli 3% Novocaine solution, and to the Novocaine injected, and after that we use horn which innervated by other nerves when we do anesthesia here, and this is anesthesia we use during this operation, 3% Novocaine solution, 10 milli, 5 milli, or maybe 15 milli. This is indications, depends of age and weight of animals. Amputation technique, how we should amputate these horns for cattle. Having processed the horn twice with iodine solution, before our operated, we use disinfection with iodine solution, and we should remove with wire or sheet saw. These tools we should use during this operation. Sheet saw, we use special saw, sheet saw, we can use wire saw, we use needle holders, needs, threads, and after removing horns we should apply some sutures, loop shaped sutures we can use knotted sutures, and in young animals have a horn, the base can be cut off special scissors. These scissors pruning shears, but sometimes we use sheet saw because this instrument very good when we use easily during operation. We use sheet saw, but we can use special special scissors during operation on the young animals. And about stop bleeding, when we can see when bleeding occurs, we want to stop bleeding with tamponade mechanical methods. And here we can see operation on the horn. We use needle holders, some forceps for fixated base of the horn, fixated skin which located base of the horn, and after removing we can see, and with stitches, applying with stitches, we can finish this operated. Operations on the teeth. Teeth operations on the teeth which come on the a lot of animals. We should, this is blockade mandibular nerve block, nervus mandibularis, and we should use this on both sides, prevent this is both sides. Indications for relaxation of the chewing muscles, we use this operation. We use different manipulations during different manipulations which located in oral cavity. Pharynx, initial part of the esophagus, we can use anesthesia. For tongue, teeth of the which located lower jaw. Premedication, for premedication we use chlorpromazine, and we can use the chlorpromazine, and we can use rompun. Rompun, after that premedication, we can see where it give good result, we can see. And this anesthesia maybe last 1.5 to 2 hours, this operation maybe last. And blockade in cattle. We should find this straight line. This is of the eye to the lower edge of the nasal and of the auricle, which, and I see it, this interval here, I want to show. For example, this is located, this is of auricle, for example, here we can see. This is, for example, head, and this is eye. Here we can see, students. This is base of the auricle, base of the here. This is outer edge of orbit, interval between outer of edge of orbit and interval between base of horns, this interval, located middle, their middle point. And 1 centimeter below this interval, we can see this puncture site. This we injected, we should inject it, 5 milli, 3% Novocaine solution. Five ml of 3% Novocaine solution, and after 5 minutes we should inject 20 ml Novocaine solution. This places outer of orbit, edge of outer of orbit and base of the horn between this interval and 1 centimeter below this middle located puncture site, and injected we should there 20 ml Novocaine solution. And relaxation of chewing muscles and dropping lower jaw occurs after 5-10 minutes and lasts 1.5 to 2 hours. And I say it here, for example, this is auricle, base of auricle and outer edge of orbit, which located this interval, and middle of this interval, and 1 centimeter below this puncture of injection point. And but interval A to B, this is air line, and this point which located middle and 1 centimeter below this located injection point for mandibular nerves. Horse teeth alignment, this is, we use sharp edges of the molars which damage mucous membranes, the oral cavity. tongue and cheeks and interfere with the intake chewing food. Fixation instrumentation, we use special tooth rasp for removal molars and premolars, which located in the covered on side with large and other with small notches we use. And the animal's trachea in the pen assistant opens, which this is oral cavity, and firmly fixed in the machine, this animal, and assistant opens oral cavity and either when yawning or when pulling the horse's tongue. And we use tranquilizers and antipsychotic drugs we use for calm animals. And here we can see this molars, which located in the maxillary. Here, molars and premolars. Here we can see the first picture. We can see molars and premolars. This operation in the cattle maybe use this operation. We maybe use in the horses. About molars. Dental instruments. Which instruments we choose during this operation? We use rasp. The first we can see. The first rasp from 2 to 5 located. This is dental instruments, dental scissors, special dental scissors. The 6 gripping the ground of the tooth here. From 7 to 11, this is dental forceps, and 12 universal dental forceps and selection forceps. We can see the certain numbers. Selection forceps, and has a medical forceps. This medical forceps, special instruments, special tools when we use during this operation of teeth when we want to remove these molars or premolars. And operation technique, this how we should move how we should do this operation technique. We use this is for removed for removed teeth. We use this is with forceps with rhythmic movements with slight pressure, grind protruding surface of tooth, and first with large rasp notch, and we can use first large this is notches, rasp with notches, and after that small rasp with notches. After this procedure, we should wash oral cavity with weak solution permanganate, potassium permanganate. With this procedure, we should do 1 times in a day during 4 or 5 days. We wash oral cavity with weak solution potassium permanganate. After this procedure, about orbit operations, orbital nerve blockade, which operated, we should operate it in the eye orbitals, orbital operations, blockade technique in cattle, and injected 1.05 or 2 centimeter dorsally to the temporal process of the zygomatic bones, and we use the injection dips. This is injection dips with 10 centimeters, 20 milli, 3% Novocaine solution of the orbit. And here we can see has a defect in the horse of upper eyelid, lower eyelid, in the third eyelid has a defect. We can see here, and this is before operation with defects, 3 position, and 3 position after operation with stitches, after applied stitches. Which defect has a here after sutures, which has a defect after sutures. These operations on the eyelids. Extirpation of the eyeball, why we use these methods. Extirpation of the eyelid, we use suppurative panophthalmicus, destruction of the orbit structure, we use indications, direction of the eyeball when this orbit falls out. Fixation and pain relief, we use in large animals, we use operated in machine, but the small animals we use this operation in the surgical table. And which tools we use during this operation? We use Mövzu forceps, needle holders, needle, dressings, and some tampons for stop bleeding. Operation technique, distance centimeter from edge of the eyelids should be 0.5 centimeters. And the first, after that, we should know about how we should remove fatty tissues, muscles, nerves, and after that we use which tools? Scissors, curved scissors, straight scissors. We use these scissors for removed orbits from the orbit's eye, and after that we should put the drainage. After this procedure, we should apply stitches. Stitches will be knotted stitches, and if possible, maybe occurs bleeding. We should stop bleeding this with tampons. Pressure, and we should put ligation to the orbit artery. And here we can see inserted capillary drainage into the orbit, and I say after 8 days we can remove these stitches. And after 2 or 3 weeks, this conjunctiva covered, this orbit covered with conjunctiva, and the eyelids grow together. Inversion of the eyelids, these indications we use during chronic conjunctivitis by dropping inversion of the lower eyelid. Anesthesia and large animals we fixed in the machine, and we use chlorpromazine, aminazine. And the third, about operation technique, we use near the edge of the eyelid 0.3, 0.5 centimeters, the sagittal area of the skin, exercise so that the base, which has a formed defect, facing, and then the edges of the flow connected fragment stitches, fragment knotted stitches. And here we can see orbital sinus in the peak, a puncture of the orbital sinus in the peak, which located some nerves here, orbital nerves and arteries. Excision of the third eyelid of the eye, indications, tumor, growth, large horn in a cattle maybe, coronavirus preventing normal vision maybe. Anesthesia we use Novocaine, 3% Novocaine solution. Operated technique, large animals operated standing posture, but small we can operate it in the surgical table. And this is how we should remove this third eyelid with quickly instruments. Quickly we should remove this third eyelid, and if has occurs bleeding, we should stop bleeding with tampons, and we can use for instrument we can use this is forceps, special tweezers. We can use surgical tweezers. Operation in the tongue has operations different places, damage on the tip of the body of the language. We can use this operation in the language. For anesthesia we use 3% Novocaine solution. We can use 10 milli of the vein which located under the language, and after that anesthesia maybe occurs after 5-7 minutes and lasts 1.5 hours. This we can see lingual nerves which located here, nerve links, and injected some different needles posture which located positions which located under the language, which located different arterias, veins, lingual vein, and hypoglossal nerve which located here, hypoglossal nerve. And operations in the auricule, indications, ulcers may be different, neoplasms, necrosis. We use large animals 8-12 age and small animals 5-6 week age. We use this operation on the Doberman, pinchers, boxer, and doga. This is three breeding of dogs we use. And has two tools, two types of air forceps which we use, and here we can see the structure. The first we can see the boxer, the second we can see Doberman pincher, and the 3 dogs. we use instrument screw air clips, and maybe here we can see the first curved and the second were S-shaped, which for applied in the auricle and give which shape which want owner of animals. And here we can see this is Doberman pincher. Here we can see the structure of auricle. This is boxer. And this is German dogs. And fixation and pain relief, given this dog lateral position in the surgical table, and especially effective when we use this anesthesia, for example, rompun. And we can use sometimes general anesthesia, calypso and calypsabet, which doses depends on weight and age of animals. And after that, we can do this operation. Operation technique, we should put tampon into the air because maybe bleeding, and after that we can put these air clips to the S-shaped or straight line or curved these air clips to the into the air, and after that with scalpel we should cut these places. When we apply suture, we shouldn't took cartilaga because it's very important places. We should put we should apply stitches without cartilagas, and this is anesthesia maybe after 5-10 minutes, and occurs general anesthesia or only local anesthesia. This operation lasts this is 20 or 25 minutes. And surgical treatment of cynorosis, coinerosis in sheep. And about this operation, I would like to say some information about shortly information, because it has a capsule, which in the capsule located a lot of gelmins. This gelmins located in the brain of the sheep, in the brain. This is coinerosis capsules, which located here a lot of gelmins and located in the brain. We should know these places of trepanation places, and with Couture's trepan, with phrases, we should remove this capsule. But this capsule, we should remove entire forms, because we shouldn't damage, because maybe stay some gelmins and maybe development there grows. And bladder, for example, this is coinerosis bladder. After removing bladder, after 1 week, 2 weeks, I think this operation give good result. Here we can see this capsule when we removed with injection needle, but it's not give good effective because some gelmins stayed here, we can see here. But when we capsule operated, and when we want to take entire forms of this capsule bladder, coinerosis bladder, maybe we cannot see these gelmins them. And tools, we use scalpel, pointed tweezers, we use needle holders, needles, dressings, syringe, maybe. And during operation, we cannot use, and I say needles, because needles injection, with needle injection, when we want to remove this coinerosis bladder with needle injection, it's not give good result, good effective, because we can see stayed here some gelmins and maybe development there grows. Fixation and pain relief, the sheep we should give a lateral position in the machine, and we use Novocaine solution. If we cannot see result, we should do general anesthesia with calypso or calypsabet, mixed doses, and I say this sheep doses of calypso or calypsabet depend of age of weight of this sheep. And operation technique, we should find this trepanation place, and after that with scalpels, with trepans, we should remove this coinerosis bladder. After that we should apply stitches, knotted stitch on the brain, and some times, for example 2 weeks, 3 weeks, we can see good result. Here we can see this coinerosis bladder, which is located in the brain, and this is position of sheeps. which located in the brain. It's not normal position of ships. Injures the head by hitting the wall. Here we can see it's not. And after some times, we can see ship died. Thank you, attention, our students and teachers. Thank you.